In the countdown. If there had been any doubt that significant health care reform were needed, those doubts have been shouted down, and not just by the justices of that South Carolina highest court. President Obama today taking his campaign for health care reform to the University of Maryland, where he told thousands of cheering college students that Congress must resist scare tactics and false accusations. Their loudest cheers coming when the president spoke about the public option.
Now, I've also said that one of the options in the insurance exchange should be a public insurance option. Let me be clear. It would only be an option. No one would be forced to choose it. No one with insurance would be affected by it, but what it would do is provide more choice and more competition and put pressure on private insurers to make their policies affordable and treat their customers better.
The crowd at College Park also booed most loudly when he spoke about those determined to keep things exactly as they are, broken.
There are still those in Washington who are resistant to change, who are more willing to defend the status quo than address the real concerns of the American people. What can I tell you? They're still out there.
More booing, if not as boisterous, when the president brought up Senator Max Baucuss and his health care reform bill that does not reform any health care.
The good news is we are now closer to reform than we've ever been. After debating this issue for the better part of a year, there's now agreement in Congress on about 80% of what needs to be done. 4 out of 5 committees in Congress have completed their work. Yesterday, the Finance Committee, under the leadership of Max Baucuss, put out its own bill. Each bill has its strengths, and there are a lot of similarities between them.
Governor Howard Dean all but booing in reaction to the Baucuss bill, calling it, quote, the worst piece of health care legislation I've seen in 30 years. In fact, it's a $60 billion giveaway to the health insurance industry every year. It was written by health care lobbyists, so that's not a surprise. It's an outrage. I wouldn't vote for it at all under any circumstances.
55% now say they want a government-run health insurance plan for competition. That's up from 52% in August, you know, the month that the Democrats were supposed to have been hosed all the place, right? This is what I have predicted all along. Here we are, we're down to 0 Republicans on board with the president. You know, the guy that got elected, the guy that won 9 Bush states. Mr. President, no matter how well you explain it, no matter what the forum, no matter what the speech, they're not going to be with you. They don't get it. They don't support you. You're going to have to do it alone. They don't pay attention to facts and logic, and they certainly don't pay attention to the American people. The American people have got the Republican Party's number. 62% of Americans now say the Republican Party is not negotiating in good faith when it comes to health care reform. Americans know the Republicans are only interested in killing reform. You can't work with somebody if they're going to be angling for failure all the time. Now, I think the White House is starting to get this. Senior advisor David Axelrod is now starting to talk a little tougher on the public option.
He continues to believe it's a good idea. He continues to advocate it, and I'm not willing to accept that it's not going to be in the final package.
This is what is so confusing to a lot of Democrats. Senator Kent Conrad out of North Dakota, chairman of the Senate Budget Committee and the Gang of 6 in the Finance Committee. The numbers are with the Democrats, with the liberals. Yet he's making this pitch saying that a number of bills out of the House have no chance, not going to make it, can't get the votes. Are you tired of being told that we don't have the votes and the public option is dead? The American people want this. Senator Conrad, whose side are you on? The Republicans or the American people who want the public option?
Senator Harkin says a silent majority of Americans support it. The most recent poll seems to support Senator Harkin's assessment, most respondents clearly favoring a public option as part of health care reform, and yet the same poll found that a majority would also support a bill without it. Finally, you may be surprised at what the nation's doctors think of the public option, especially since many opponents act like all doctors hate Medicare and any other government program. But a new poll by the New England Journal of Medicine and the Robert Wood Johnson Foundation found that 63% of physicians supported a public option. An additional 10% support a single-payer system, for a grand total of 73% favoring a public option or something obviously far stronger.
Quinlan Rosner Research, Democratic polling company, conducted an instant poll of independent voters both before and after the speech. So again, this is what folks thought about health care reform before the president spoke, and then what they thought about health care reform immediately thereafter. Anna, welcome. What were your results?
Thank you. Well, what we saw were very positive results for the president, both in the research we did last night, but also the poll that CNN did of people who watched the speech. And we saw in both, surveys was about a 15-point shift towards being more favorable towards the health care proposal, somewhere around 66 to 70% favoring. One of the most important things that happened really was also an increase in intensity of support. One of the problems for Democrats has been that there's been more intensity on the opposition side than on the support side. And one of the most important things I think that the president accomplished last night was actually increasing the intensity of support among Democrats and independents who might support this plan.
Yeah. And Karen, it brings me back to the
with a co-op. The co-op would have to negotiate rates with doctors and hospitals, and these co-ops could be too small and too weak to command truly favorable rates. And as startups, they might have a difficult time ramping up to compete with established insurers.
According to two folks who run co-ops, one in Seattle and one in Minneapolis, who I was on the phone with earlier, I said, is this going to help? And they said, no, we're not charities. You have to spend money. You have to pay premiums to join our co-ops, and we don't take everyone. We do say no to some people with pre-existing conditions. Now, one of them said our prices are middle of the road. We're the average price for, our premiums are about what other people's premiums are.
Well, then what's the point?